All right. Well, hello, everybody. Hello to the LinkedIn world and to the podcast world. My name is Mike Lyons. Thanks for joining us. This is LinkedIn Live, hosted by me and sponsored by Seasoned Advice, my HR consulting business, where I help healthcare businesses hire, retain employees better and minimize their HR risk. And the point of these LinkedIn live sessions is to have guests who are experts in healthcare or leadership or some combination of that, or just people I find fascinating. And today's guest is no exception. Today's guest is Hillary Golden. Hillary is a patient strategy consultant, keynote speaker, and advocate in the glaucoma world. So we're going to be talking about glaucoma patient experience today, and I'm super passionate about eye care. I've spent a lot of time working in the eye care world, and I just think it's so fascinating. And I love interacting with folks like Hillary. She has a ton of knowledge and passion around this because she didn't start out being passionate about this. So we're going to talk about her history a little bit of how she came to this. But I hope that you'll find it a good discussion. And even if you're not in the eye care world, I hope that it'll be a meaningful discussion. Maybe you're interested in healthcare in general, or maybe glaucoma is not your focus. But I think there will be some takeaways here that will be useful. And so with that, I would like to welcome Hillary. Thanks for being on the LinkedIn Live with me.
Thanks for having me, Mike. I'm really excited to be here today. And I think we're going to have a great discussion and look forward to sharing some information and having a nice back and forth with you.
Yeah, and just as a little additional plug, so yeah, you've done some keynote speaking in the eye care world, and so you're a passionate advocate for all this stuff. So maybe let's start with a very briefly, like, how did you come to this point in your life to be passionate about eye care and glaucoma specifically?
Yeah, it definitely, I didn't run to it, it ran to me. So I've been in medical sales for over 25 years. I've sold everything from software to hardware to imaging, CAT scans, everything in between. I've also been involved in computer guided surgical navigation training, so training doctors on that. And then in July of 2020, I went to the eye doctor for a sty, and I went to see an optometrist, and I thought, kept putting hot compresses, nothing was working.
Mm,
And I thought, well, I need to go get this checked out. So I go to the doctor and they said, well, do you want to do a full eye exam? And at the time it was during COVID, so everything was shut down. So I actually had time to sit there and get a full eye exam. And I said,
mm,
sure, why not? And so they dilated my eyes. And the first thing she did was look inside my eye. And she said, I don't like the look of your nerve. And I
mm,
said, well, look, lady, I'm here about this sty. And like, that's my main concern. So, we'll just deal with this nerve stuff like later. She's like, well, I'm more concerned about your optic nerve than your sty, and
mm.
we need to address this now. And so, the change in her voice just told me, like, okay, this is not just something minor. This is a big deal.
Mm,
She said we need to do some more tests. So we did some more tests. She had me come back. She made me promise her that I would come back. And, when she said that multiple times, promise
wow.
me, that's when I knew, like, okay. But I didn't know enough to be too scared. I just thought, she's overreacting. Whatever this is, she's overreacting.
Hmm.
And so I came back, we did some more tests, and she said, I need you to go see a glaucoma specialist. And knowing what I know now, and seeing my test results from then, I mean, I don't know how she kept as cool as she did, because she just, we need you to go here. I need you to promise me that you're going to go to the glaucoma specialist. And so I went to the glaucoma specialist, and she confirmed that I had glaucoma,
Mm,
and it was, severe. I had lost almost 40% of my sight at diagnosis, which is super scary.
mm,
And that's why I say, knowing what I know now and seeing my tests, it was a big deal, and
Mhm.
she wasn't overreacting, and I did need to get to a glaucoma specialist as soon as possible and get it addressed. So it was urgent, and I'm glad it happened. And I'm glad I had that sty that day, because if I wouldn't have had the sty, I might still be undiagnosed. And
So that was unrelated, huh?
totally unrelated. And that's usually, so I have a weird kind of glaucoma. I'll call it weird because I have normal tension glaucoma, which means, most of the time what I thought I knew about glaucoma was that, you had to have high eye pressure,
Yeah.
and you had to be like in your 70s.
Mhm.
And so I was like, how could I have glaucoma? Like, my pressure, they told me my pressure was normal, and then I'm not 70, so how do I have it? And knowing what I know now, you don't have to be in your 70s. You can get it at any age. And also, you can have a lower eye pressure that's considered normal and still have damage.
Mm.
So that's why I wasn't diagnosed till it got really bad, because my pressures were normal. So there was no red flag that came up for the
Mm.
doctors to go, oh, we need to look further into this. Um, so most people with normal tension, they don't get diagnosed till there's a lot further along as far as the damage and progression.
Mm. So, I come from the retina world, so I know a lot about some of the signs and symptoms that people come into retina with.
Yeah.
But it sounds like I mean, you didn't realize that you had this vision loss.
No, so your brain is an amazing organ in your body. And as you're losing sight, your brain does something called interpolation. And interpolation is
Mhm.
kind of filling in the gaps. So I told you I used to sell CT scanners. Well, when you sell CT scanners, CTs take slices, right? So it's digital slices, and then it puts those slices together. Well, there's tiny little spaces in between those slices, and it doesn't necessarily know what's in that space, but it fills in that data using the information from the adjacent slices. So you're kind of interpolating, that data is called interpolated.
Mm.
And so when I was diagnosed, I was like, oh, my brain's interpolating the data. The doctor was like, wait, what? And I was like, yeah. And I mean, although they knew that word, they didn't have a patient telling them that. But I was thinking of my 3D days and going, yeah, because the date I'm getting pieces, so it's actually filling in the information that it's
Okay.
missing. And so because it's doing that, most people with glaucoma don't have any symptoms at all. If you have narrow angle glaucoma, that's a little bit different, and that can actually cause pain,
Mm.
really bad headaches, and your pressure would be going up really, really high. Sometimes people's pressure goes in the 60s, so it's called a narrow angle attack. That has symptoms, but for
Mm.
the most part, most types of glaucoma do not have those same symptoms. So it is the reason why they say go get an eye exam, because if you've lost a tiny bit of sight, you don't notice it. Even though
Mm.
I've lost a ton of sight,
Yeah.
I don't really notice it because it's by my nose, and my brain is filling in that data. So
Mm.
it's kind of hard for people to understand how you lose sight,
Yeah.
because I used to think, you either are blind or you're sighted. And now
Right.
I know that there's lots of variations across there. It's not just one or the other.
Well, I am definitely gonna make sure I get my eye exam
Yes.
scheduled
Please
here.
do.
I and I didn't expect that to become, an outcome of our conversation today, but, that for those listening, that's a great thing to do, right? It sounds like make sure you get your eye exam because you just
Yes.
never know.
Yes, and I was getting one regularly, and it just shows you that,
Mm.
no matter what, even if you think your eyes are okay, there's so many eye diseases, like you talked about. There's so many retinal diseases,
Mhm.
just with glaucoma is more of a group of diseases, but it damages your optic nerve. And with retina, they're doing a lot of research. They're doing a lot of research with glaucoma as well,
Mm.
and there are going to be some new treatments coming out for genetic diseases in retina.
Yeah.
And with glaucoma, they're trying to restore sight, but it is hard once you've lost sight in glaucoma to it's gone as of right now. And I
Mm,
always say as of right now because the research is ongoing and there's trials being done right now to transplant retinal ganglion cells into the optic nerve to try to regrow that area that's, lost sight. And, one day we might be able to do it. For now, we've lost it, it's gone, but, I have hope. I have hope
yeah,
for the future. And that's kind of, earlier we talked about, why did I get in this space? Like, why am I passionate about this? I mean,
yeah.
I came from, the dental world and dental sales and then moved into ophthalmology because, with my diagnosis, I started selling glaucoma devices and went into glaucoma surgeries and was training doctors on how to do the surgery for glaucoma,
Mm,
with the devices. And, I saw that there was a big gap, and the gap was between, the doctor and the patient and these companies that are creating these devices. So there's, three pieces to the puzzle, a lot more than that, but three main pieces. And then there's all these gaps in between. We talked about that interpolation. So how
mm,
do I interpolate these three pieces and make them connect
mm.
that are not
Yeah.
connected right now? And there's some connection, but doctors are limited on their time based on their reimbursement and based on their schedules. There's not enough glaucoma specialists, there's not enough
Mm,
ophthalmologists, and
mm,
so they're having to see so many patients a day because they're just overloaded. And then
mhm,
that cuts down on the time that they get to spend with a patient. So we're always talking about compliance in eye care, especially with glaucoma, because you're using these drops most of the time.
mm,
And when you're talking about that, doctors are saying, my patients aren't compliant. But a lot of times, I always push them a little bit further and say, well, do your patients trust you?
mm.
And I'm not saying that to try to challenge them or question them
Yeah.
in any way. I'm saying, do your patients trust you? Because do you spend enough time with them for them to trust you? And it's not their fault. It's the system. And when you get diagnosed with something like glaucoma and they say, okay, use these drops or you're going to go blind. Okay. I
Mm.
don't know that that really works.
Yeah.
I'm trying to change the paradigm and say,
Mm.
use these drops so you can see the colors of the world.
Right.
Use these drops so you can see your daughter get married. Use these
Yes.
drops so you can see your son graduate from college. Like, there's so much more than threats that you can use to
Yeah.
paint the picture.
You know, I'm a big fan of what you're talking about right now, and that's that's what motivates people. I think is the outcome. What is the outcome that I'm going to get here? Is it just okay?
Exactly.
You're not going to have this symptom anymore. No, it's I'm going to have a richer experience.
Yes.
I was at a my son had a orthodontic visit the other day, and the doctor was just masterful in painting a picture of actually literally showing on a video, this is what your son's jaw looks like, and this is why this problem is an issue, and this is how we can solve it, and these are some of the things that could be outcomes later if we don't address it, and just took the time to educate and inform. For me, I have never been to an orthodontist. This was all new to me. I probably could have used the same treatment my son's about to get, but it was so wonderful the way it was expressed to me, and just I was like, yes, where can I give my money right now
Yeah,
for
where do I sign?
yeah. It's very
Yeah,
motivating.
yes, and I think that when you can paint that picture and you can paint a positive picture, not just, and they didn't just tell you like, if you don't do this, your son's gonna, have this, have TMJ pain the rest of his life, all
Right.
these things that could be possible, right? But they
Yeah.
told you like because you could have potentially had that same surgery and you're like,
Yeah.
oh wow, it could have changed part of your life, right? Because it could have been maybe better in a way
Yeah.
and helped you with some jaw pain or whatever it is. And those are the kind of things that I think really make the difference. And ideally, if it was an ideal world, we would have a patient educator, patient advocate in
Mm,
every ophthalmology office that could
right.
take the time
Mm,
and explain these things. Like, that's not the reality of today. Hopefully down the road, that's where healthcare is going, or at least ophthalmology,
Yeah.
because people are walking out and, like you said, there's no symptoms, right, for glaucoma. So most of the time, and you're telling me to use this drop that's going to give me symptoms. So it's going to make my eyes red, irritated, burning, and itchy.
Yeah.
That's what most drops can do. And then there's other side effects as well. But
Yeah.
those are just a few, right? So I'm telling you to go home and use this drop, and it's going to actually make your eyes red and hurt, and the doctor doesn't necessarily tell you this. So you go home. The first time I had a drop, I went home, started using it. My eyes got red, itchy. So I just stopped using them
Yeah.
because I said, well, the doctor wouldn't have given me a drop that irritates my eyes because we're trying to help my eyes.
Mm.
And, I've had eye infections in the past where they give you drops, your eyes feel better.
Right.
And these were making my eyes feel worse. So I was like, why would I use a drop that makes my eyes feel worse? So then I go to my appointment the next time. Have you been using your drops? No, I think you gave me the wrong drops. What? So, and here I am. I've been in healthcare. Like, I know what it is to be a patient, but yet I thought they gave me the wrong drops. And they said, well, no, that's, the side effects. And it's
Mm.
like, whoa, okay. So now you're telling me that I have a disease with no symptoms and I have to use a drop that's going to give me symptoms. And then that's going to save my eyesight down the road. But in the meantime, my eyes are just going to be red all the time. And so these are, it sounds like they're little things,
Yeah.
but over time this compounds, and then you have to get on multiple drops, so then your eyes
Mm.
are even more irritated. And the drops have something called BAK in them, which is kind of like a bleach, and it's to keep the bacteria from forming in the drops, but it also damages your cornea. So then people have cornea issues. So you're fixing one thing and hurting another, which happens a lot of times with
Sure.
medications and drugs, right? I mean, every
Yeah.
drug has a side effect. But so all of this has to be balanced. And if the patient doesn't understand this, that's when you run into the non-compliance. So
Mm.
it's not just that patients are non-compliant because they forget or there's apathy, or, they just don't see the point. It's
Mhm.
because these drops are hurting their eyes. And there's ways you can work around that. They make preservative-free drops that are easier on your eyes. You could potentially get a surgery, and you could potentially get off the drops altogether, or maybe, cut your drops in half. Instead of being on 3 drops, you're only on 1. So there's options, right? But people don't understand this. Some people just stop going altogether to the doctor, and they're just resigned to the fact that I'm going to go blind. And the bottom line is, with glaucoma, if it's found, once it's found and it's being treated, the chance of going blind is very, very, very minimal. There's things that can be done.
Yeah. It makes me think about a retina doctor that I know of who always wanted to get to know the patient and tell me about your life, tell me about your
Yeah.
family, what do you like to do in your free time? And I think it was a calculated move. I mean, obviously this is a nice doctor, they want to get to know their patient, but it serves a purpose because empowers that physician to be able to say, well, I know you're passionate about woodworking. This is going to help you, preserve your vision, preserve your ability to do the thing that you love to do. And I know you mentioned that you have grandkids, and just kind of what you were saying is help to provide that motivation for the patient to want to continue treatment, which it may not be fun. No one wants us to go sit
Right.
and go have an OCT and go have an FA or whatever. They don't, and then get an injection in your eyeball, right? Those aren't necessarily fun things, but there's a reason why we do that.
Absolutely. And I think, the doctors that take the time and talk to the patients, and, it's all about relationships, and that just is building trust, right? So I mentioned trust earlier, and that's why I think it's so important, because if a doctor doesn't tell you there's going to be possible side effects, if they don't tell you, what all of your options are, then the trust, it's like trust erodes slowly, then all at once. Okay. So, the doctor's running late, like all these little things
Mm.
They don't acknowledge you in the office. The tech that brings you back doesn't say your name. They don't say, who they are. They don't tell you what they're going to be doing. These are little things that I notice that, not all patients are going to notice, but I think it's so important to, take the patient back, acknowledge the patient. Hi, Hillary. Today we're going to be doing a visual field test on you. Are you familiar with that? Even if I've been there 100 times, just, are you familiar with that? Do you understand what we're going to do? Yes. Get all of that and
Yep.
gain agreement before you're doing the procedure. And coming from a background in sales, it's like you always gain agreement before you move to the next step. So if you started out and there's like a miscommunication and you keep going, that's going to stay in that person's mind. That misunderstanding that they never got
Mm.
over is still going to stay in there. So
Yeah.
you've got to address it when it comes up. Otherwise, it's stuck, right? You're stuck. So let's move forward and keep gaining agreement. Yes, I understand we're going to do a visual field. Then sit down. You've done this before. Do you need me to explain what we're going to do today? You're going to press this little button, like all those things, and it's a fine art because you need to do it in a way where you're not condescending, right? And you're not placating the patient, but you're giving them space to say, hey, I've done this before. I'm really comfortable. I know what we're going to be doing. I'm still nervous about it, but I appreciate you explaining it to me. And like, that's as simple as it has to be. And you can make such a difference. And that's where that, trust piece is like, if you're handled well and you feel like, they held your hand as you walked back, not literally, but figuratively,
Yeah.
they're taking care of you. They're watching out for you. Then you finish your test. I'm going to walk you into a treatment room now, or I'm going to walk you back into the waiting room. And then we're going to come get you in a few minutes. Like all of those little steps make such a big impression on a patient. And it all makes a difference with compliance. And I mean, I know there may be
Mm.
doctors that fight me on that, but I'm going to tell you, it makes a huge difference because you trust the staff, you trust the techs, you trust the front desk, you trust the doctor. You're going to be more compliant with your meds. I mean, you just are. It's the reality.
So yeah, I in my background, we would train our technicians and our front desk staff on a 5-step service process, and everything you said is exactly what we would teach, and it actually applies to leadership as well. And so, greeting the patient, being responsive to their emotional state, right? So are they
Yeah.
worried? Are they stressed? How can we address that?
Yeah.
Explaining, this is a big one, right? So just what you said, I'm going to give you these drops. They're going to cause this, and this symptom, but you're going to get a certain benefit from that. So taking the time to explain, asking questions, and then explaining what's going to come next, so people know what to expect. And leaders can do this too. So as an HR person, I'm always interested in the leadership aspect. But as a leader, we can do those same things with our staff. So giving the employees an experience. And believe me, we want to have compliant, not only do we want to have compliant patients, but we want to have compliant employees. And so
Yes.
the things you're talking about work with employees as well. So explaining, giving reasons, and building trust is huge. I love that you talked about that with patients, because nothing is more sensitive, like, hey, lean back and I'm going to do something with your eyeball right
Yeah,
now. Like, that is a vulnerable moment, right?
it is. It
Yeah.
is, and it makes such a difference, like you said, just those little things in explaining. Um, I had an experience with a tech one time, and as I said, it's a fine line, it's a balance, right? So I went in for an appointment, and I had this. The tech was assigned to me, and she just kind of would mumble, and then whenever she would explain things to me, she would. It was just very, okay. So what we're
Mhm.
gonna do, and I just felt very, I felt it was like very patronizing, and I felt like I'm not hard of hearing. I'm not, like you can talk to me like I'm a person. And I felt like she was kind of like talking down to me, and
Mm.
it just made me feel really uncomfortable. So I went in another time and I get the same tech, and the same thing happened. And and every time I would go, I would start crying because the eyes are losing sight is a very sensitive subject, and
Yeah.
it's very emotional. And here I am trying to, taking all my strength to go in there. It was when I was, in the first couple years of being diagnosed, which I was still figuring everything out. And now I'm almost 5 years diagnosed, and
Mm.
I'm in a different place. But at the time, I was still, it was very raw and trying to figure everything out. And every time I would go, I would just be crying and
Mm.
crying. And I told so the third time I went and I got the tech, I'm like, okay, evidently she's assigned to me some kind of way. I don't know
Exactly.
if they did that or not, but it seemed like that. And so I said, I can't just do this anymore. And when the doctor and the scribe came in, I said, I, I, this girl that brought me back is very sweet, but I'm sure she means well, but there's something in our personalities that's not working, and I
Mm.
need to get a different person. And again, it's just me, right?
Yeah.
She may do that with everybody, and everybody else is fine, and maybe it's just not didn't work for me. But for me, I had to say that I was uncomfortable, and it's part of what brought me to be more of an advocate about my healthcare, is because of situations like that where I just thought, I just have to do this, I just have to, tolerate this.
Mm.
And um and and that's just what I'm resigned to. And I think that's what a lot of patients feel like when they go in, like, you just have to get whatever comes at you. And so I told the doctor and the scribe, I said, look, I think I need a different person. Can you just in the notes or whatever you need to do, I don't know, but just put a different person. And nothing against her. I don't think she means like it's coming across, but
Yeah.
there's something about it. It's not working for me. The next time I had a different person, and I had a totally different experience, and I didn't cry that whole visit. And, so that makes it's like little things like that make a huge difference. And
Yeah.
then it also told me, when you feel uncomfortable, like, say something,
Mm.
it wasn't, and again, I wasn't, it's not like I was going online and giving a bad review and saying, if you
Yeah.
get, Sally as your tech, you're going to cry when you leave. Like, that was not what my intention. That's not
Yes.
what I wanted to do. I just wanted to say, hey, can we do this maybe a little differently? Because I'm finding that when I come here, I'm leaving in tears every time, and
Yeah.
it's just like ruining my day. So, and I don't feel like I'm getting as good of an appointment because I was so emotional, and I
Right.
needed to get questions answered. So I needed to be available intellectually as well as emotionally. And I
Yeah.
felt like I can't do that if I'm getting thrown off in the beginning of the appointment.
And this just that highlights the importance of hiring people with good emotional intelligence, right? And so being able to recognize the patient and where that patient is at. Maybe they do need a slower, speech. Maybe they need like a more of um, a focused, communication style, or maybe they need some information delivered in a different way, or maybe they need but you have to be able to recognize that, oh my gosh, whatever I'm doing, this person is going in a bad direction, how can I turn that
Yeah.
around? And so with something that's a high trust a service like ophthalmology, you got to have good emotional intelligence in your staff. And the other thing is, you gave a gift to that practice, because they get to give feedback, hopefully, to that person of like, hey, you know what, not everyone likes that, or how can we tweak your style, right? And that's a learning point for that person. And so hopefully that person was able to learn from that experience. But you highlighted that for me, like, probably most patients, they probably 99% would not have done that, right? They would have
Right.
maybe stopped showing up or go to a different doctor or whatever, just to avoid that conversation.
Yeah, and I think that's why, you realize you have to stand up for yourself. Like, I talk to patients all the time, and they're scared to get a second opinion because they don't want to hurt their doctor's feelings. And I get it.
Mm.
But when I told my doctor, I said, oh, I need to go see this other doctor because there was something that he was doing that was different. And I said, I want to just go there and get another opinion. And he's like, oh, that guy's great. Go there.
Mm,
Those are the kind of doctors that you
yeah.
want because they don't have all this ego in the way where they're, threatened by you going to get a second or third or fourth opinion. It's like the guys that are and the gals, I mean, I have a female glaucoma specialist now that's amazing. And, when they are open to you getting other feedback and getting another opinion and
Yes.
just because with glaucoma, there's no like there's no there's a certain amount of an algorithm where, okay, you put them on drops, they'll get SLT, which is a laser that you can try to drop your pressure that way, and then there's surgery. But as far as like how you do those steps and which surgery you pick, it's totally different. It is just like crazy how many people have different opinions. So if you go to 5 different glaucoma specialists, you could get 5 different opinions on what surgery you should have. So
Mm,
it can be very overwhelming. That's a lot of information. And so I do think you can run into analysis paralysis when you get too
mm,
many opinions and you're just kind of stuck because you're so confused. So you have to have some education up front in order to make that decision. But, you know, you have to get the information, and the doctors that are open to it and that are open to the feedback, that's where you can really make changes because I'm sorry, no matter how many people you have coming into your office, there's always going to be someone who has a bad experience, no matter what. No matter if you have a perfect staff and
yeah.
you have perfect everything. And not that anything's ever perfect, but there's always going to be places where you can get better. And that's why I think, with speaking, I, go to a speaking class every week. And we give speeches and we get feedback and they say, this is what you did really well. This is where I think you could make some changes, and this is what I challenge you on. So we get good, we get the bad, and then we get the where could you push yourself? Like, I see this in you. Like, I don't think you see it. And that's where, you can take that into an office setting and do that with your employees. And most offices do, but since there's a lot of turnover right now, it's really hard to get techs. So I think you're getting what you get, and sometimes you don't have as many options, so you've got to learn how to do this feedback better,
Mm,
because if you're limited on your options, then you got to make the ones you have better. And the only way to do that is through feedback, and it's not easy to give feedback. It wasn't easy for me to even say, hey,
yeah.
can I get a different tech next time, because
Yeah.
our situation's not working. And
And what I have found is if that trust is there, you build a foundation of trust, and so maybe that doctor had built a certain trust level with you, and that then you knew that, okay, if I say something about this, then this physician is going to take care of it, right? And so there was or maybe you just powered through it, but hopefully there was a trust level that they had, that where you're like, okay, I know that I feel safe with this doctor. They're going to respect my choice and my feedback, and they're going to help, put someone else on my whatever account next time.
yeah, because it's scary because you don't know how your feedback's gonna be taken. And sometimes, I think that's what most patients are afraid of, is that,
Mhm.
they give this feedback and there's pushback. And then they're, "I wanna get a second opinion." "Oh, well, go get a second opinion, but, once you leave here, don't
Yeah.
ever come here again."
Yeah. My
Like,
wife was at she had a primary care doctor for a while, and the staff was really kind of surly and like, well, questioning her, and she left that practice. But like you talked about, the little things that send a message about your practice, whether it's the front desk or the people answering the phone, the doctor or the tech, like you receive messages. Is this a safe place for me? To voice my concerns. Is this a safe place for me to get treatment or whatever? And everything needs to be sending this message: safe, safe,
yes.
safe. And if it's not, then you risk, you're going to have a leaky bucket of patients, right? Leaking out of your practice and going elsewhere. And like, that's a total judo move that you mentioned, of like, oh, you want to go see someone else? I love that. I mean, what a great, that communicates trust. And like, I care about you, Hillary, because you know what? It doesn't matter if you see me, if you see Sally, if you see Dr. Smith, like, I want you to be taken care of. And boom, that's a trust builder right there.
Absolutely, and it just shows, like you said, they are caring about you as a person in your eyes, and they want the best for you. And if that other doctor has something that no one else is doing, and that can potentially help you, I'm on board with it, you know?
Mm,
And, so those are the things, like, not only does that build trust, but then you feel, like, seen and heard, and I think as a patient, that's what we all want is,
mm,
we all want that in life, but especially as a
yeah,
patient, you wanna feel, seen and heard, and I felt like, okay, he sees me, he hears me, he knows that I'm not just gonna sit here. I'm not the kind of patient that just sits here and goes, "Okay, use this, do this, and,
right.
come back in 6 weeks, and we'll check your eyes again, and then do this, come back." Like, I'm not that patient, and, I'm gonna ask questions. I would go in with my phone, and in my notes app,
Yeah.
every day I would, like, be driving and like, "Oh, wait, I need to ask this," or I would, I'd be driving and I'd be talking into my phone, "Make a note of blah, 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 blah. Ask this question next time you're in the office." And so I'd go in and have all these questions. And I got to the point where I'd say, they want to put the drop in your eye, the numbing drop in so they can take your
Mm,
pressure when you first sit in the chair. And I
mhm,
would say, nope, we're not doing that yet. We're answering these questions. And it was like I wanted to answer my questions.
mm,
And then once I knew they would answer my questions, then I would let them put the drop in, trust my pressure, do the rest of the exam, and then I would open my phone and ask my questions. But it was like I had to what I needed more was those questions answered. I needed the questions answered more than I needed the rest of the exam.
mm,
And so that what was more important to me, and that's why I led with the questions, because I said, "Just please let me do this first." And again, it takes time to become that advocate for yourself, but I realized, like, after going, because you go a lot, right? I go a
yeah,
lot 'cause mine is severe. Some
mm,
glaucoma patients go twice a year.
mhm,
Some go 3 or 4 times a year. I go more often than that. So I was going a lot, and it's like when you go a lot, you observe things, and I'm a big observer, and I'm very curious, so I'm always trying to figure things out, or how could this be better, or how could this be easier, or how can I be calmer in my appointment? Like, all these things are going through my head the whole time I'm sitting there. I'm not just sitting
mhm,
there waiting for my appointment. I'm
mhm,
thinking, "Oh, that guy has a walker, and where's he gonna sit, and can I help him sit more easily, or can I move? Am I in a position where it's a better seat?" Like, all these things are going through my head. So when
mm,
you're having all that, and you have to figure out, what do I need ultimately as a patient, as a person, in everyday life, but when we're talking about the patient side, what do I need? And, like, you've got to bring that to the forefront. And yes, I know you need my pressure. Yes, I know this, but I need this more than I need you to know the pressure.
yeah. So this is making me, I don't know that we've touched on that moment. So you had your diagnosis and it sounded like you stayed in sales, but more on the ophthalmology side. But tell me about that transition into advocacy and consulting and because it sounds like you have a lot of passion and you're sitting there in the office and you're like, "Oh, I could improve this or this could be better," right? And so you have a lot of value to add. How did you kind of make that leap from I'm going to stop doing the sales thing and I want to start adding value in a new way and talk about that a little bit.
Yeah, so after I was diagnosed, I had been in I was training on the computer guided surgical navigation, and then I started, like, researching glaucoma. When I'm researching glaucoma, like, a job comes up, like, "Oh, a job selling a glaucoma device." Like, "Oh, that would be, right in my wheelhouse." And again, this is when I was, like, it's in early days of being diagnosed, so I'm, like, still wrestling with all this internally, trying to figure out, people keep this diagnosis quiet, people don't talk about it, and so I was, still in that space of, like, I don't know how I'm gonna address this or talk about this or whatever. And once I started, went into training with the first company that I worked for, and I'm sitting in a training class, um, and got the job selling a device, sitting in a training class with, about 50 other people. And there's doctors that are coming up and talking to us. And the doctors are saying, like, here's a visual field. What would you do for this person? And I'm looking at these visual fields, and it's like visual field after visual field after visual field. And all of them just have, like, these little gray spots. And I'm
Mhm.
thinking, mine is like black. This whole quadrant is black. Like,
Mm,
why are they showing these? And I had never seen anyone else's. I had only seen mine, so I didn't know what it was supposed to look like.
mm,
So sitting in that room, I realized like, oh wow, then they'd show one and they say, oh, this is a moderate to severe person. And I'm thinking, well, what am I?
mm, mm,
And we took a break. The last doctor that presented, everybody's walking back into the room. The last doctor that presented sitting at a table. And I walk over to him and I said, "Hi, I know you just presented." I said, and most of the people had gone. So it's just like me and him. And I said, "This is my visual field. Like, what do you think of what do you think of this?" And he was like, "What?" And I could just see in his eyes that, all of a sudden he starts saying, "You need to have a trab," which is, if you know anything about glaucoma, it's like the most severe surgery you could have. Um,
mm, mm,
because of normal tension, it's hard to drop pressures low enough. It's easier to go from high, the percentage of, dropping that, you can drop it pretty good. But when you're low and you just have to drop, 3 points, it's harder to get that lower drop than it
mm.
is to get that higher drop.
Yeah.
So he starts telling me all this, and then my head is just like, all I start hearing is wah, 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 wah,
Right.
the Charlie Brown talk. Like, I'm not hearing anything else he's saying.
Yeah.
And I said, after he finishes talking, I'm like, okay, thanks for the information. And I walk away. I walk into the room, and all of a sudden, like, my eyes well up. So I walk straight to the bathroom and just start crying because I didn't know that my eyes were severe.
Mm,
So once I realized that, it kind of took that for me to realize it. And
mm,
once I realized that, I just said, there's a reason that I have this. There's a
mm,
reason, that God gave me this. And I have all these years of medical experience. I have this comprehension of, you know, reading these studies and being able to extrapolate information for patients really easily. Like, comes easily to me. I can't just have this for myself.
mm,
I have to be able to share this. And that's when I realized, like, this isn't about the glaucoma. Like, this is a bigger than that. This is a calling. And I feel like I've been called to, be that, talked earlier about those 3 pieces, to be that, like, that interpolation between the patient, the doctor, and these companies, because
mm,
I think with the background that I have and the experience that I have, it really, like, combines these in a way that is really hard to find somewhere else. And so what I've found is, in speaking and telling my story and sharing that, with companies and doing consulting and explaining to reps,
mm.
uh, what I really love to do that I haven't done yet is to go into these new rep training. So I
Yeah.
explained about that training that I was in. We had like 5 doctors come talk to us. We didn't have any patients. The
Mm,
patient's where the story is. The doctor's the solution, right? And they're talking about that, but there's like a huge piece missing. Where's the patient in that? Where is the patient? All these companies say they're patient focused, but then they're not bringing patients in to talk. And,
mm.
so I'm all about bringing patients in, talking to patients, hearing patients' stories, because that's where that's where the value is. It's
Mm,
what's going to help, what's going to change people, what's going to motivate people. It's the story. And so when you bring someone in to talk to your sales force and you say, this is a patient and this is who you're helping, I'm happy to be the face of glaucoma for that. It's not
yeah.
something that I've ever wanted, but since I'm here, I'm going to use it the best I can. And that's when I kind of, everything changed for me that day. And I said, I can't just be in the passenger seat of this car anymore. I have to get out. I have to get in the driver's seat. I don't know where I'm going that day. I didn't know where I was going. I didn't know what I was going to do, but I knew I couldn't stay in the passenger seat. I knew I had to change.
Wow. It sounds like a real, I don't know, lightning bolt moment for you. And it's clear, like, you have so much passion around that anyone, and you talked about, the 3 stakeholder groups, right? you could be of such benefit to the patient world, the provider world, the treatment world, and I think even like educating employees as well. Practices could definitely leverage the knowledge and experience that you've had to help employees understand, like, hey, we have a sacred responsibility here. This is why we're doing what we're doing. I mean, what a powerful purpose to help someone through this journey, and it gives you more empathy, I think. So one thing I want to say for those listening here, while I can take a break to mention, if you have a question for Hillary or a comment, we would love for you to drop that into the LinkedIn comments on the live page. We will see those and we can respond to them. So if you have something for Hillary or a question, or if you just want to say hi, tell us how great we're looking on camera today. We love to hear that too. Thank you for that. Um, and so, yeah, I love the work that you're doing. Let's see here. You have a lot of knowledge about the treatments that are being done, and some of the up and coming treatments. It sounds like you spend a lot of time educating yourself about that, attending conferences and learning about that. Are there any? I don't know what's fascinating that's coming up about glaucoma treatment for you right now that you want to share.
Yeah, there's so much coming in the pipeline, which is really exciting because there needs to be just constant research. And I love researchers because they're doing like this work in these boring little cubicles at their bench, and looking in the microscope and trying to find things that are going to potentially save people's sight or restore sight. And that to me is just I mean, they don't get enough thanks. But there's so many things in the pipeline. There's some new goggles that are coming out that help patients like me that have normal tension that you wear at night when you sleep, and it uses negative pressure to lower eye pressure. And
Mm,
then at night when you lay down and you're in a supine position, your eye pressure goes up. Just everybody, even if you don't have glaucoma, like that happens because your blood pressure is changing, the way your blood flows through your body because you're in that laying down position. And so when you're up, the pressure in your eyes is lower just because you're sitting up or standing. And so when you're laying down and at night, you can get these pressure spikes in your eyes. So wearing these goggles overnight is kind of like wearing a CPAP machine,
mhm,
but for your eyes. And so you're
mm,
protecting your eyes and keeping your eyes at that pressure level that the doctor wants without those spikes. So that's something that's interesting because it's not, a drug or a drop. It's something that's like neuroprotective. So we're trying to protect the optic nerve by using those, and also lowering pressure in a way that doesn't add another drop on to the regimen, which can
mm,
decrease compliance and all that. So that's exciting. There's lots of new drugs coming out too. There's an endothelin blocker that's coming out that in the past endothelin blockers have been used for other diseases, and it's a systemic drug. Number one, they're really expensive. Number two, they've got a lot of side effects, and this is something that's injected directly into the eye for glaucoma, which could be an incredible breakthrough. So there's all this new research, and
mm,
like you mentioned, this a lot of this is talked about at meetings, and I try to go to a lot of the conferences, the medical congresses, and the meetings. And what I really am trying to do as well is get these meetings to have patient speakers, because there's all
mm,
these doctors. Again, there's all these doctors that speak, but there's not a lot of patients that speak. And maybe they'll have one patient, maybe, and you'll be in a little room somewhere. But
mm,
even if you had patients speaking, like keynote speakers at these events, even though doctors are seeing patients every day, you're still not hearing the full story. You're hearing bits and pieces, and they get it, but it's like there's so much more to these people than just these like 5 minute 10-minute appointments that you see the patients at. So that's one of the things I'm trying to really champion, is for
mm.
these conferences to have patients come speak, because again, I mean, that's where the value lies, is in the story. And even if it's not me, it's like, I don't care if you don't want me, that's fine, but I want a patient up there, you know. I want a patient, I want to hear from a patient, and I think it makes such an impact. And the doctors bring huge value, and I think there's some conferences that'll have doctors speak with patients, and I'm going to do that this summer with the Glaucoma Foundation.
Mm.
They have a think tank meeting, so I'm going to be at that, and we're going to have a doctor's going to speak, and then I'm going to speak right after the doctor. So it's kind of giving both perspectives, the patient and the doctor perspective, which
Mm.
I think is something that is unique, and needs to really be on a broader scale.
Awesome. Well, we're I've really enjoyed this conversation. You've shared so much knowledge and passion on this subject. And so I appreciate you joining me. I've learned a lot. Glaucoma wasn't something that I knew much about, and so I feel like I have gotten to walk in your shoes a little bit, and it sounds like that's really a lot of what you are trying to do. And so, hey, it worked here for me. I have a
Well,
better
good.
understanding, and I want to ask, how can people get in touch with you if they would like to work with you and learn more about what you do?
Yeah, so I have a website. It's just I founded a company called Glaucoma Coach. My website is glaucomacoach.com, so pretty easy. And then I am on LinkedIn as my name, Hillary A. Golden, and I am on Instagram as glaucoma_coach.
Okay.
And those are the main places that people can find me. And again, my email is pretty easy too, hillary@glaucomacoach.com. So I'm pretty easy to reach. All of that is available also on my website, for contact information. And yeah, I like you said, I'm passionate about this subject. I am, fighting to make people more aware of glaucoma, just so they get eye exams.
Yeah.
I just want you to get an eye exam. I don't care how you get it. Just go get one. And, your kids, your wife, like everybody,
Yeah.
make sure everybody gets an eye exam. And that's really the best thing you can do,
Mm,
for your eyes, because like I said, there's so many different eye diseases, and some of them have symptoms, but, many of them don't. And, or they do, but if you catch them early, then you could really stave off a lot of trouble down the road. So, I think
thank
it's
you for,
really
yeah. I'm moved by that, and I absolutely will schedule my eye exam in the near future. So I personally thank you for that. I'm so glad that we're connected. I cannot wait to share this with my network because I feel like this was a great discussion. And um, thank you so much for joining me. And thanks to everybody who watched and participated or is listening. If you have questions for Hillary, please follow her. Please check her out. Please communicate with her. She's so passionate, and I think she could add a lot of value for your eye care practice. And you know, can't say enough good things about that. So, thanks for joining. My name is Mike. I am HR consultant who specializes in healthcare. So if you ever need any support with staff recruitment or retention, that's what I do. And so, yeah, this has been this edition of LinkedIn Live with me. I love to have guests on who talk about healthcare and leadership and anything in that spectrum. And Hillary, you've been a wonderful guest for me today. So thanks for joining.
Thank you, Mike. I really enjoyed it. It was really fun. Thanks for having me.
Awesome. Thank you. And I hope everybody has a great rest of their day. Bye bye.
Bye bye. Thanks.